Hello guys, how are you? I hope so that you will be enjoying good health and you all will be fine. Today's my topic is on high blood pressure, which is called as hypertension. So we will start here. What is hypertension? I will tell you that half of all Americans have high blood pressure, also known as hypertension, and many do not even know that they have it. High blood pressure develops when blood flows through your arteries at higher than normal pressures. Your blood pressure is made up of two numbers. Number one is systolic and the another one is diastolic. Systolic pressure is the pressure when the ventricle pumps blood out of the heart. And diastolic pressure is the pressure between the heartbeats when the heart is filling with blood in the chambers. In the chambers. Your blood pressure changes throughout the day based on your activities. For most adults, a normal blood pressure is less than 120 over 80 millimeters of mercury, which is written as your systolic blood pressure reading over your diastolic pressure reading as 120 over 80. Your blood pressure is considered high when you have consistent systolic readings of 130 mm of mercury or higher or diastolic readings of 80 mm mercury or higher. The classification has been done about blood pressure levels, and I will tell you that normal is the systolic less than 120 millimeter of mercury will be normal one, and the diastolic 80 millimeter of mercury will be less than 80 millimeter of mercury will be of diastolic pressure will be the normal pressure. And when it is called elevated, it is called elevated when the systolic is in the range of 120 to 129 millimeter of mercury and diastolic is less than 80. And high blood pressure is when the systolic is 130 millimeter of mercury or higher, it means it is more than 140, and diastolic is more than 90. So this is the high blood pressure. You usually don't have symptoms from high blood pressure until it has caused serious health problems. About 1 in 3 US adults with high blood pressure are not even aware that they have it or are not being treated to control to their blood pressure. That is why it is important to have your blood pressure checked at least once a year, and to control lower high blood pressure, your provider may recommend that you adopt a heart healthy lifestyle. And this includes choosing heart healthy foods such as those in the DASH eating plan. You may also need to take medicines. Controlling or lowering blood pressure can help prevent or delay serious health problems such as chronic kidney disease, heart attack, heart failure, stroke, and possibly vascular dementia. As far as symptoms are concerned, it is important to have a regular blood pressure readings taken and to know your numbers, because high blood pressure usually does not cause symptoms until it has caused serious problems. Undiagnosed or uncontrolled high blood pressure can lead to serious health problems such as aneurysms, strokes, chronic kidney disease, eye damage, heart attack, heart failure, peripheral artery disease or carotid artery disease, vascular dementia. How to diagnose the high blood pressure or hypertension? I will tell you that we have some screening tests. Everyone aged 3 or older should have their blood pressure checked by a healthcare provider at least once a year. Your provider will use a blood pressure test to see if you have consistently high blood pressure readings, because sometimes it may be higher in nephrotic syndrome, which is commoner in children. How to prepare for a blood pressure test? Your healthcare provider will use a blood pressure test to see if you have a higher than normal blood pressure readings. The reading is made up of two numbers, systolic number and the diastolic number. These numbers are measures of pressure in the millimeter of mercury, and a blood pressure test is easy and painless and can be done in the provider's office or a clinic, either a GP clinic. The provider uses a gauge, stethoscope, or electronic sensor and a blood pressure cuff to measure your blood pressure. Prepare for the test by following a few simple steps. Do not exercise, do not drink coffee or smoke cigarettes for 30 minutes before the test. Go to the bathroom before the test. For at least 5 minutes before the test, sit in a chair and relax. Make sure your feet are flat on the floor. Do not talk while you are relaxing or during the test. Uncover your arm for the cuff. Rest your arm on table so it is supported and at the level of your heart. If it is the first time your provider has measured your blood pressure, you may have reading taken on both arms. Even if you do prepare, your blood pressure readings may not be accurate for other reasons. You are excited or nervous. Suppose white coat hypertension refers to blood pressure recordings that are higher in a doctor's office than readings at home or in a pharmacy. Providers can detect this type of high blood pressure by reviewing readings from office and from other places. Your blood pressure tends to be lower when measured at a provider's office. This is called masked high blood pressure. When this happens, your provider will have difficulty detecting high blood pressure. Your provider can recognize this type of high blood pressure by looking at readings taken at the office and at home, especially at night. The wrong blood pressure cuff was used. Suppose your readings can be different if the cuff is too small or too big. It is important for your healthcare provider to track your reading over time and ensure the correct pressure cuff is used for your sex and age. You can also take your blood pressure at home or at a pharmacy. Measure your blood pressure has more information about measuring your blood pressure outside of the healthcare provider office. Talk to your healthcare provider if your blood pressure readings are consistently higher than 120 over 80. NHLBI supported research has shown that systolic blood pressure greater than 120 mm of mercury can be increasingly harmful to health. Readings above 180 over 120 millimeters of mercury are dangerously high. They are dangerously high and require immediate medical attention. For children younger than 13, blood pressure readings are compared with readings common for children of the same age, sex, and height. How will my provider find out if I have a high blood pressure? You may be diagnosed with high blood pressure based on your medical history, and if your blood pressure readings are consistently at high levels. You may also need more tests to look for medical conditions that could cause high blood pressure or see if high blood pressure has affected your kidneys. Medical history. Your provider will want to understand your risk factors and get general information about your health, such as your eating patterns, your physical activity level, and your family's health history to develop a treatment plan for you. They will ask questions to see if blood pressure has caused you any health problems. This will help determine if you need to undergo any tests. Confirming the high blood pressure. To diagnose high blood pressure, you need two or more blood pressure readings at separate medical appointments. What are the causes and risk factors that will cause high blood pressure? Many factors raise your risk of blood pressure, high blood pressure, and some risk factors such as unhealthy lifestyle habits can be changed. Other risk factors such as age, family history, and genetics, race and ethnicity, and sex cannot be changed. A healthy lifestyle can lower your risk for developing high blood pressure. What is a healthy lifestyle? So, healthy lifestyle, I, I would tell you that heart healthy living involves understanding your risk, making healthy choices, and taking steps to reduce your chances of getting heart disease, including coronary heart disease, the most common type. By taking preventive measures, you can lower your risk of developing heart disease that could lead to your heart attack. You can also improve your overall health well-being. Heart disease is a leading cause of death in the United States for both men and women, but you can do a lot to protect your heart and stay healthy. Learn about the steps you can take to live a heart healthy lifestyle. We were understanding the risk factors for heart disease, and now we will come to the risk factors for heart disease. These factors may be different for each person. Preventing heart disease start with knowing what your risk factors are and what you can do to lower them. And the first step toward heart health is understanding you the risk of heart disease. Risk factors for heart disease are if you have high blood pressure, if you have high blood cholesterol, if you have a overweight or obesity, if you have pre-diabetes or diabetes, smoking, you do not get regular physical activity or exercise, if you have a family history of early heart disease, for example, if you have father or brother were diagnosed before the age 55, or your mother or sister were diagnosed before age 60, before age 65, if you have a history of preeclampsia, which is a sudden rise in blood pressure and too much protein in the urine during the pregnancy, have an unhealthy eating behaviors, or if you are age 55 or older for women, or age 45 or older for men. Each risk factor increases your chance of developing heart disease. The more risk you have, the higher your overall risk. Some risk factors cannot be changed. These include your age, sex, and a family history of early heart disease. Many others can be modified. For example, being more physically active and eating healthy are important steps for your heart health. You can make the changes gradually at once at a time, but making them is very important. Women and heart disease. Women generally get heart disease about 10 years later than men do, but it's still women number one killer. After menopause, women are more likely to get the heart disease, in part because estrogen hormone levels drop. Women who have gone through early menopause, either naturally or because they have had a hysterectomy, are twice as likely to develop heart disease as women of the same age who have not gone through these menopause. Middle age is also a time when women tend to develop other risk factors for heart disease, such as high blood pressure. Preeclampsia, which is a high blood pressure during pregnancy, raises your risk of developing coronary heart disease later in life. It is a risk factor that you cannot control. However, if you have had the condition, you should take extra care to monitor your blood pressure and try to lower other heart disease risk factors. You and your healthcare provider, a heart healthy partnership, and risk factors such as the high blood pressure or cholesterol generally do not have obvious signs or symptoms. A crucial steps in determining your risk is to see your provider for a thorough checkup and risk assessment. Your provider may use a risk calculator to estimate your risk of having a heart attack, having a stroke, or dying from a heart or blood vessel disease in the next 10 years or throughout your life. For example, the atherosclerotic cardiovascular disease, a SCVD estimator, considers your cholesterol levels, age, sex, race, and blood pressure. It also factors in whether you smoke or take medications to manage your high blood pressure or cholesterol. Your provider can be an important partner in helping you set and reach a goal for heart health. Ask about your risk for heart disease at your annual checkup. Since your risk can change over time, keep asking each questions to ask your provider at your annual checkup are: what is my risk of developing heart disease? What is my blood pressure? What does it mean for me? And what do I need to do about it? What are my cholesterol numbers? What do they mean for me, and what do I need to do about them? What is my body mass index BMI and waist measurement? Do I need to lose weight for my health? What is my blood pressure level and what blood sugar level? And does it mean I am at risk for diabetes? What does other screenings test for heart disease do I need? How often should I return for checkup for my heart health? How can we work together to help me quit smoking? How much physical activity do I need to help protect my heart? What is a heart healthy eating plan for me? Should I see a registered dietitian or a qualified nutritionist to learn more about healthy eating? How can I tell when I am having a heart attack? If you already are being treated for heart disease or heart disease risk factors, discuss your treatment plan with your provider. Ask questions if you do not understand something or need more information. You may want to write down questions before your appointment as well. Questions to be discussed about your heart disease prevention and treatment plan. How does my treatment compare with what is recommended in the latest guidelines? How well is my treatment plan working for me? Are my risk factors for heart disease in a good range or getting better? If your provider recommends medicines or a medical procedure, ask about the benefits and risks. Get your blood pressure and cholesterol checked. Two of the major risk factors for heart disease are high blood pressure and high blood cholesterol. If either of these number is high, work with your doctor to get into a healthy range. High blood pressure is the force of blood pushing against the walls of your arteries. As your heart pumps blood, if this pressure rises and stays high over time, it can damage your heart and your vessels and lead to plaque buildup. Most adults should have their blood pressure checked at once a year. If you have high blood pressure, you will likely need to be checked more often. Talk with your healthcare provider about how often you should have your blood pressure checked. Your provider will measure your blood pressure to see if it is higher than it is recommended. The reading is made up of two numbers with the systolic number above and diastolic number. These numbers are measures of pressures in millimeters of mercury. Your blood pressure is considered high when you have consistent systolic readings of 140 millimeter of mercury or higher, or diastolic readings of 90 millimeter or higher. Based on research, your provider may also consider you to have high blood pressure if you are an adult or child aged 13 or older who has consistent systolic readings of 130 to 139 millimeter of mercury or diastolic readings of 80 to 89 millimeter of mercury, and you have other risk factors for heart disease. If your blood pressure is high, your provider will suggest lifestyle changes and may prescribe medications. You can track your blood pressure progress with our tracking numbers, your number worksheets, and bring it with you whenever you have your blood pressures taken. Tracking your numbers. What is high blood cholesterol? High blood cholesterol is a condition in which your blood has an unhealthy levels of cholesterol, a waxy like fat like substance. Many factors affect your cholesterol levels. For example, age, sex, eating patterns, and physical activity level can affect your cholesterol levels. Children also can have unhealthy cholesterol levels, especially if they have overweight or obesity or their parents have high blood cholesterol. A blood test can show whether your cholesterol levels are healthy. Talk with your provider about having your cholesterol tested and how often you needed this tested. Your cholesterol numbers will include total cholesterol, bad LDL cholesterol, and good HDL cholesterol and triglyceride. Ask your provider what these numbers means for you. If you have unhealthy cholesterol levels, your provider may suggest the lifestyle changes discussed in this topic. If heart healthy lifestyle changes alone are not enough, your provider may prescribe a statin or other medicine to help manage your cholesterol levels. Choose heart healthy foods. Heart healthy eating involves choosing certain foods such as fruits, vegetables, while limiting others such as saturated fats and added sugars. Your doctor may recommend the heart healthy dietary approaches to stop hypertension eating plan. because it has been proven to lower high blood pressure and bad LDL cholesterol in the blood. See delicious heart healthy eating for recipes, cooking tips, and more information. Foods to eat. These foods are the foundation of a heart healthy eating plan. Vegetables such as leafy green, spinach, collard greens, kale, cabbage, broccoli, and carrots. Fruits such as apples, bananas, oranges, pears, grapes, and prunes. Whole grains such as plain oatmeal, brown rice, and whole grains bread or tortillas. Fat-free or low-fat dairy foods such as milk, cheese, or yogurt. Protein-rich food, fish high in omega-3 fatty acids, salmon, tuna, and trout. Lean meat such as 95% lean ground beef or tenderloin or skinless chicken or turkey, eggs, nuts, seeds, and soy products, tofu, legumes such as kidney beans, lentils, chickpeas, black eyed peas, and lima beans, oils and food high in monounsaturated and polyunsaturated fats, canola, corn, olives, safflower, sesame, sunflower, and soybean oils, not coconut oil or palm oil. Nuts such as walnut, almonds, pine nuts, nuts and seed butters, salmon and trout, seeds, sesame, sunflower, pumpkin, or flax seeds, avocados, tofu. Foods to limits. A heart healthy eating plan limits sodium, salt, saturated fat, added sugars, and alcohol. Understanding nutrition can help you choose healthier food. Limit sodium. Adults and children over the age 14 should eat less than 2300 milligrams of sodium a day. Children younger than 14 may need to eat even less sodium each day based on their sex and age. If you have high blood pressure, you may need to limit the sodium even more. Talk to your healthcare provider about the amount of sodium that is right for you or your child. Try these shopping and cooking tips to help you choose and prepare foods that are lower in sodium. Read food labels and choose products that have less sodium for the same serving size. Choose low sodium, reduced sodium, or no salt added products. Choose fresh, frozen, or no salt added food instead of pre seasoned, sauce marinated, brined, or processed meat, poultry, and vegetables. Eat at home more often so you can cook food from scratch, which will allow you to control the amount of sodium in your meals. Flavor foods with herbs and spices instead of salt. When cooking, limit your use of pre-made sauces, mixes, and instant products such as rice, noodles, and ready-made pasta. Limit saturated fats. Saturated or bad fats come from animal sources such as butter, cheese, and fatty meats. They should make up less than 10% of your daily calories. Unsaturated fats are also known as good fats and are found in vegetable oils and nuts. Read food labels and choose foods that are lower in saturated fats and higher in unsaturated fats. Eat leaner, lower fat, and skinless meats instead of fatty cuts of meat and chicken with skin. Consume lower fat dairy product instead of whole milk. Use certain vegetable oils such as olive and canola oil instead of butter, lard, and coconut and palm oils. Limit added sugars. You should limit the amount of calories you get each day from added sugars. This will help you choose nutrient rich foods and stay within your daily calorie limit. Some foods, such as fruit, contain sugar. Natural sugars, added sugars, do not occur naturally in foods but instead are used to sweeten foods and drinks. They include brown sugar, corn syrup, dextrose, fructose, glucose, high fructose, corn syrup, raw sugar, and sucrose. In the United States, sweetened drinks, snacks, and sweets are the major sources of added sugars. Sweetened drinks include soft drinks or sodas, fruit drinks, sweetened coffees and teas, energy drinks, alcoholic drinks, and flavored waters. Sweetened drinks account for about half of all added sugar consumed. Snacks and sweets include grain based desserts such as cakes, pies, cookies, brownies, Donuts, dairy desserts such as ice cream, frozen desserts and puddings, candies, sugars, jams, syrups, and sweet toppings. Lower how much sugar you eat or drink. Choose drinks without added sugar such as water, low fat or fat free milk, or 100% vegetable juice. Choose unsweetened foods for snacks or desserts. Eat sweetened drinks, snacks, and desserts less often and in smaller amounts. Limit alcohol. Talk to your healthcare provider about how much alcohol you drink. They may recommend that you reduce the amount of alcohol you drink or that you stop drinking alcohol. Alcohol can add calories to your daily diet and possibly cause you to gain weight, raise your blood pressure and levels of triglyceride, fats in your blood, contribute to or worsen heart failure in some people, such as some people who have cardiomyopathy, raise your risk of other diseases such as cancer. If you do not drink, you should not start. You should not drink if you are pregnant, are under the age of 21, taking certain medicines, or if you have certain medical conditions including heart failure. You should eat the right amount of calories for your body, which will vary based on your sex, age, and physical activity level. Remember that some healthy foods, including oils and dairy, can still have a lot of calories. Some fruits can have a lot of natural sugar, especially when they are dried. Develop a personalized food plan at your Get My Plate plan. You might be having aims for healthy weight. A healthy weight for adult is generally a body mass index BMI between 18.5 and 24.9. The online BMI calculator will help you measure your BMI. Download the BMI calculator app for iPhone and Android. If you are if your body mass is below 18.5, you are underweight. If it is 18.5 to 24.9, then you are healthy weight. And if your BMI is 25 to 29.9, then you are overweight, and you are obese if it is more than 30 or 30. So always talk to your healthcare provider about your BMI means for you, and talk to your child's providers to determine if they have a healthy weight, because their BMI should be compared to growth charts specific to age and sex. And following a heart healthy eating plan and being physically active are some ways to help you achieve and maintain a healthy weight. What is the aim? What are the physically active plans? There are some physically active plans. Regular physical activity can help you lose your excess weight, improve physical fitness, lower many heart disease risk factors such as LDL cholesterol levels, increase good HDL level, and manage high blood pressure, lower stress, and improve your mental health, lower your risk for other conditions such as type 2 diabetes, depression, and cancer. Talk with your healthcare provider before you start new exercise plan. Discuss how much and what types of physical activity are safe for you. Even moderate amount of physical activity are good for your health. Aerobic exercises benefit your heart and lungs the most. This is any exercise in which your heart beats faster and you use more oxygen than usual, such as brisk walking, running, biking, and swimming. The more active you are, the more you benefit. Participate in aerobic exercise for at least a few minutes at a time throughout a week. The U.S. Department of Health and Human Services Physical Activity Guidelines for Americans recommends that each week adults gets at least 150 minutes, 2 hours, and 30 minutes to 300 minutes, 5 hours a week of moderate intensity aerobic physical activity, or 75 minutes, 1 hour, and 15 minutes to 150 minutes, 2 hours, and 30 minutes a week of vigorous intensity aerobic physical activity, or a combination of both moderate intensity and vigorous intensity activity. Adults should move more, and sit less throughout the day. Some physical activity is better than none. Manage your stress levels, which will be helpful for you. Research suggests that emotionally upsetting events, particularly when involving anger, can serve as a trigger for a heart attack or angina in some people. Stress can contribute to high blood pressure and other heart disease risk factors. Some of the ways people cope with this stress, drinking alcohol, using other substances, smoking, or overeating, are not healthy ways to manage stress. Learning how to manage stress and cope with the problems can improve your mental and physical health. Consider healthy stress reducing activities such as talking to a professional counselor, a psychologist, participating in a stress management program, practicing meditation, and being physically active, trying relaxation techniques, talking with friends, family, and community or religious support systems. Ask your healthcare provider what kind of stress management activities are safe for you. So, and then you have to quit smoking. If you smoke, quit the smoking, and which can raise your risk of heart disease and heart attack and worsen other heart disease risk factors. Talk with your doctor about programs and products that can help you quit smoking. Also, try to avoid secondhand smoking, and your heart has more information about the negative impacts of smoking on your heart. If you have trouble quitting smoking on your own, consider joining a support group. Many hospitals, workplaces, and community groups offer classes to help people quit smoking. You should also talk to your healthcare provider if you vape. There is scientific evidence that nicotine and flavoring found in vaping products can damage your heart and lungs. You must get enough good quality of sleep, which will lower your high blood pressure. Sleep plays a vital role in good health and well being throughout your life. During sleep, your body is working to support healthy brain function and maintain your physical health. Not getting enough sleep or good quality sleep over time can raise your risk of chronic health problems. The amount of sleep you need each day will change over the course of your life. And recommended hours of sleep a day according to age. Babies of the age 4 to 12 months require 12 to 16 hours of sleep including naps, and children 1 to 2 years require 11 to 14 hours of sleep including naps, and children 3 to 5 years require about 10 to 13 hours of sleep including naps. Children 6 to 12 years age require 9 to 12 hours of sleep, and teens 13 to 18 years require 8 to 10 hours of sleep. Adults 18 years or older require 7 to 9 hours of sleep. Sleep and heart health is related. Sleep helps heal and repair your heart and blood vessels. It also helps maintain a healthy balance of hormones that make you feel hungry or full, support healthy growth and development, support a healthy immune system. Over time, not getting enough quality sleep, called sleep deficiency, can raise your risk of heart disease, obesity, high blood pressure, diabetes, and stroke. So, how to sleep better? You can take steps to improve your sleep habits. First, make sure that you allow yourself enough time to sleep. Learn strategies to avoid sleep deprivation and deficiency. It may help to spend time outside every day if possible and be physically active. Avoid nicotine and caffeine. Avoid heavy or large meals with a couple of hours before bedtime. Avoid alcoholic drinks before bed. Go to bed and wake up at the same time every day. Use the hour before bed for quiet time. Avoid exercise and bright light. Take a hot bath or use relaxation techniques before bed. Keep your bedroom quiet, cool, and dark, and it will be helpful to manage your sleep. Thank you for listening this video, and if you like this video, then don't forget to subscribe it. Thank you very much for listening my video. Have a nice day.